What is a cystoscopy procedure, and what can you expect? Imagine being able to see inside your bladder without surgery. That's what a cystoscopy allows healthcare providers to do. This procedure helps doctors examine the inside of your bladder and urethra directly. It's a common, minimally invasive test used to diagnose and sometimes treat urinary tract issues. If you're experiencing symptoms like blood in your urine, pain during urination, or recurrent urinary infections, your doctor might recommend a cystoscopy to get a clearer picture of what's going on. During a cystoscopy, a thin, tube-like instrument called a cystoscope is inserted into your urethra. The cystoscope is equipped with a light and a tiny camera or lens at its tip, which transmits images to a monitor so your doctor can see inside your bladder. There are two main types of cystoscopes, flexible and rigid. Flexible cystoscopes are more comfortable and easier to maneuver, making them suitable for most diagnostic procedures. Rigid cystoscopes are sturdier and often used for certain therapeutic interventions or more detailed examinations. Before the procedure begins, your healthcare provider will prepare you by cleansing the urethra and applying a numbing medicine to reduce discomfort. This numbing is usually a gel or spray that doesn't require injections. Once you're ready, the doctor gently inserts the cystoscope through your urethra and guides it into your bladder. As the cystoscope is advanced, sterile saline solution is introduced through the instrument to fill your bladder. Filling the bladder helps stretch the walls, giving a clear view of the entire inner surface on the monitor. You might feel a sensation of pressure or a strong urge to urinate as the bladder fills, which is normal. If you experience discomfort, tell your doctor. Sometimes they can remove some of the fluid or adjust the procedure to make you more comfortable. If any abnormal areas are seen, the doctor can pass tiny instruments through the cystoscope to take tissue samples, known as biopsies. These samples are sent to a lab for analysis, especially important if there's a suspicion of bladder cancer. The entire procedure usually takes between 5 and 20 minutes, depending on what needs to be done. Afterward, most people can go home the same day and resume normal activities quickly. Some mild discomfort or a burning sensation during urination may occur for a day or two, but this usually resolves on its own. Drinking plenty of water helps flush out the bladder and reduce any irritation. From a bladder health perspective, cystoscopy is a vital tool for early detection of bladder cancer or other abnormalities. It allows doctors to see exactly what's happening inside your bladder and to collect tissue samples if needed, all in a minimally invasive way. For those with a history of bladder issues or cancer, regular cystoscopies are often part of ongoing surveillance to catch any changes early. Remember, every person's experience can vary, and your healthcare provider will give you specific instructions tailored to your situation. If you have concerns or questions about the procedure, don't hesitate to discuss them with your doctor. They can explain what to expect, how to prepare, and what the results might mean for your bladder health. Always seek personalized medical advice to ensure the best care for your individual needs.